Hi, welcome to the STAT programming. Today I'm talking about what you should know for an eCRT data package submitted to FDA. So eCRT package, which means electronic case report tabulation, it is a dataset package which will be used for FDA new drug application. The photo here I got from Adam implementation guide directly, and here this data structure will give you an overview what are the components for eCRT package. First, you will have a module photo here. Here for clinical trial, this should be module 5, and then you will have a dataset folder because this whole package is for datasets. And then under that, you will have your study protocol. You will put your protocol number here. And then after that, you have two parallel folder which are analysis and tabulations. Under each folder, you have two folders like Adam or Legacy. If your dataset is CDISC Adam compliant, then you will put your dataset under analysis. If your dataset is Legacy dataset, you will put under Legacy here. So for your SDTM dataset or raw dataset, which are tabulations, you will put either this photo or this photo. Okay, so let's see what kind of files we should put into the photos and where we should put. So for your analysis dataset, you will put these three kind of files: XPT datasets and Define.xml, Define style sheet file. So these three types of files for Adam dataset, you will put under the folder here, the datasets folder here. Okay, and for tabulations, your SDTM dataset also has these three types of files and will be put under this folder. For the programs TXT files, those files are only needed for analysis dataset, so you will put them under the programmers folder here. And within this folder, you will have another file called Programs User Guide, which have descriptions for all the programs, TXT programs submitted for Adam datasets, tables, or figures. But for the SDTM datasets, you don't need any programs to be submitted. Okay, and this file is clinical study data reviews guide. This is only needed for SDTM dataset, and I put it here. And this file, analysis data reviews guide, is only needed for analysis, so you will only need to put under this datasets folder. And the last one, complex algorithm, will be only needed and put it on the datasets folder here. So that's for the CDISC compliant study. For any datasets, or you will have to put those under the similar structure for the legacy here. So how do we distinguish if your study is legacy or CDISC? So for um, for Adam, it is if your study is CITES Adam compliant, that means your ADSL dataset is compliant. So if your ADSL dataset is Adam compliant, then the whole set of analysis dataset should be placed into the Adam folder. Otherwise, you will put them, all of them, in the legacy folder shown here. So that means you will not put files both on the Adam or and legacy. So you only need to put one, either Adam or legacy, not as two photos together. So if, for example, if your study is there's your tabulations is not as DTM compliant, then you only need to put everything for your raw data under this legacy, not as DTM photo. Okay. Another thing is for any data sets, either as DTM or Adam, if their size is larger than 4 GB, then you will have to split them and put into this split folder here. Okay. Another thing is that if you submit your datasets which claim to be CITES compliant, then you have to do the CITES compliance checks really ahead of your submission. Usually this may take a long time before all the datasets are compliant. I will talk about these topics later. So the photo to the left, this photo is really important because as a statistical programmer, this will be your final goal for a successful clinical trial. You will submit the dataset eCRT package to FDA or other regulatory agencies. So this is your end product, so you have to keep this photo structure in your mind and what kind of files will be put into each of these photos, and this will guide you the whole process of programming, maybe for many years. Okay.